Ms. Tavenner, thank you very much for being here. We are now more than 30 days into one of the greatest website disasters in history. After nearly $400 million, Healthcare.gov is synonymous now with failure. The public's trust has been broken, and the reports I'm hearing reinforces why. One in particular, we've already heard discussion on this case of the South Carolina man, is so painful that I want to dedicate my time and my questions to trying to resolve his issues. The case starts with Justin Hadley from North Carolina attempting on October the 1st to get Obamacare through the Healthcare.gov. By Halloween, just 4 or 5 days ago, he was still unable to sign up for Obamacare. However, Mr. Hadley from North Carolina immediately saw 2 download links. The link document was an eligibility notice to Mr. Dougall from South Carolina, including Mr. Dougall's name, his address, and his eligibility for subsidies. Mr. Dougall is now requesting that the personal information for all of his family be removed from Healthcare.gov because he could not remove it himself because there's no delete option for consumers. Of course, now Mr. Dougall nor Mr. Hadley will use the website to purchase insurance. Making matters worse, when my office was contacted for assistance, we called the Healthcare.gov's 800 number as well, and we asked a very specific question. Can you remove Mr. Dougall's personal information? The response was silence. 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 The response was silence. Not a yes, not a no, not a maybe, not let me check with my supervisor. They just simply refuse to have an audible word in response to our question. Silence. By the way, Mr. Dougall has called on several occasions, but no one will call him back. Not a single person has taken the time, after having his information exposed, to even call Mr. Dougall back. I tell you this story because it illustrates what happened as a result of incompetence with this website and this program. The administration and HHS knew that Americans' personal information was at risk before the website went up. I think Senator Roberts just spoke about the Inspector General's report from August that warned that Obamacare's exchanges may end up illegally exposing Americans' private records to hackers and criminals. Further, Senator Roberts alluded to the internal memo from September 27th obtained by Washington Post. And to quote that memo, it says, "Inherent security risks expose a level of uncertainty that can be deemed as a high risk to personal financial information being exposed." The memo was, of course, as you have taken responsibility, and we do appreciate that, was written specifically to you from your consortium administrator for health plan operations and the deputy CIO. You signed the authority for Healthcare.gov to operate for the next 6 months with a mitigation plan to be implemented. In other words, you authorized Healthcare.gov to go forward, realizing that the potential of exposing personal information was, and I quote from the memo, a high risk. Here are my questions. Do you believe that 6 months is an acceptable amount of time for this website to operate in a manner that puts Americans' financial information at high risk for security breach? Will you shut down the website, as my friends from the left have already suggested, until security issues are fixed? I would also like to finish by asking that we get Mr. Dougall an answer as it relates to deleting his information from the system, and that we get that answer today if possible.